Hi, my name is Dr. Shikha Jain. I am a medical oncologist at the University of Illinois in Chicago. I am also the Chief Operating Officer and one of the co-founders of the group Impact, and I am the founder and chair of the Women in Medicine Summit. Today, I'm going to be talking to you about making an impact and utilizing social media for advocacy work, public education, and then also ways to combat the infodemic and all of the misinformation that's put out there relating to healthcare and medical care. So today, my main objectives, first, I'm going to talk about how we created impact and how we can kind of use our voices to amplify others and also make an impact. I'm also going to talk about our mission, how we work, and the recipe that we've created so other people can also create a similar group or organization. And then I'm going to end with a little bit of information on how you can facilitate working with others and partnerships and collaborations to really work towards fighting the infodemic and advancing equity. I'm going to talk a lot about the pandemic and medicine in general, but to be perfectly honest, this topic is so important for oncologists specifically because, as we know, patients bring all sorts of information that they've gotten online or from other resources. Many times the information is inaccurate. And so I want to focus on how we can utilize this for public health messaging in general, but specifically in oncology, I want you to remember that all of these methodologies that I'm going to talk about are directly possible and directly able to be utilized in the cancer setting. So one big problem that we have found in healthcare is that many healthcare professionals are really reluctant to tackle misinformation for a variety of reasons. We know that there's a lot of time that can go into it. We have a million other things we're doing. There's really a challenge in finding the time to really be an advocate and to focus on this type of work. There's also a big problem, especially in this last year, where physicians have been getting burnt out. And so when you come home from being on the front lines or taking care of patients or trying to figure out how to talk to your patients over telemedicine, figuring out how to decontaminate yourself when you get home, there was a real big challenge for physicians, especially this past year, to figure out how to utilize their voices to amplify accurate evidence-based information while not also getting burnt out with all of the work that they were doing at their actual jobs. So this is a real challenge, and we've seen it amplified, especially for women in healthcare when they have caregiving responsibilities, whether it's parents or children. There's a real other burden that comes along with those responsibilities. And so there is a big challenge for healthcare workers, and especially women in healthcare, to utilize their voices and find ways to navigate this new world of social media and traditional media to really amplify evidence-based information while also finding that work-life balance that no one seems to be able to find in medicine these days. We know that medical misinformation is a problem in the patient-clinician relationship. And as I said, we've seen it in oncology for years. There's a lot of different types of misinformation that are out there. So there's the pseudoscience. I always refer to Gwyneth Paltrow as the queen of pseudoscience. Her website, Goop, which is all about lifestyle medicine, I say medicine, recommends things like jade eggs and other non-proven, non-scientific ways to treat ailments. So that's one type of misinformation. Then there's junk science. So that has really led to this distrust in an entire community relating to vaccines and has contributed to a lot of the vaccine hesitancy that we see now and a lot of the anti-vaccine movements. These are claims that are based on fraudulent or made up data. There's outdated science. So this past year, it's funny, the outdated science was almost 24 hours later. You could see a fact that was said 24 hours previous might be outdated by the next day. We see this in oncology all the time with the new standards of care, with new drug developments. So sometimes people utilize outdated information to make decisions that can also contribute to medical misinformation. Then there's inappropriately applied science. So that would be, for example, misinformation relating to the fact that there's a lot of different ways to practice medicine, and that goes to the art of medicine. And then conflicting interpretations of science, which also contributes to that, where, for example, the USPSTF and the American Cancer Society have some conflicting guidelines that are put out when it comes to certain cancer screenings. So there's a lot of different types of misinformation that's out there in the healthcare space. And it's really important to know how to identify each of these separately. I show this slide because I think it's a really powerful reminder of the power of your voice as a healthcare worker, whether you're a physician, a nurse, a social worker, an MA, a respiratory tech. This paper actually came out during the pandemic, looking at physicians and their voices on Twitter, one of the social media platforms. And what this study found was that personal tweets actually helped in educating and in public health messaging. They found that there was a very large impact on the public health perceptions and messaging when emergency medicine physicians were sharing their personal stories. And so that just goes to show the impact that our voices have and why it's so important that our voices are out there combating this misinformation when there are a lot of other celebrities and lifestyle coaches and people out there putting out information that really they're putting out for their own benefit and for their own brand, and they're not really doing it for the public good. This paper here that Dr. Aurora is referencing came out in the Lancet, talking about the different the different ways that social media can really be a response avenue for public health messaging. What they found is that social media can be both a vector and a contagion for misinformation, meaning it can really help in combating misinformation, but it can also be a way that people spread inaccurate information. So it's really important, again, that we drown out the voices of those who are not really speaking with evidence or science and are not giving best practices based on what's best for patients and individuals. We need to make sure that those voices are not the ones that are heard louder than the scientists and the experts who know the science and who are providing information based on best practices. So let's talk a little bit about impact and what we did in this last year. So we were formed at the beginning of the pandemic, and our mission was to strategically amplify the voices of healthcare workers. And our purpose was to guide policymakers as well as the public during this pandemic. We saw that there wasn't a really great national response when it came to public health messaging around the pandemic. And with new information coming so quickly, when our friends and family members started calling us and asking us what we knew that they didn't, when we started pulling our kids out of school and when we started recommending masks, we realized that the messaging wasn't getting out there. And so we utilized our networks to find ways to strategically amplify the voices of those who we thought were most impactful. We also learned how to leverage social and traditional media. We grew and leveraged some really innovative and novel partnerships and collaborations that increased our platforms. We crowdsourced. So this was a huge key to our success. We talked to people over social media, trying to figure out where the gaps were, and then found places where our advocacy would be most impactful. We created a recipe for crafting and disseminating messaging. And then we repurposed and repackaged everything that we were doing to have maximal impact and have the greatest amount of reach. You can see at the bottom, we partnered with a lot of different organizations, some that were not healthcare related at all. So we partnered with with Get Me PPE Chicago, which was a group started by medical students, and we were able to amplify their organization and their mission, and we were able to get protective equipment to nursing homes and underrepresented areas across the state and across the Midwest throughout the pandemic. We partnered with Dear Pandemic, a group of brilliant PhDs who have dubbed themselves the Nerdy Girls, and we cross-publish and cross-promote information and evidence-based messaging. The Illinois State Medical Society, we partnered with them and did a lot of messaging and also crowdsourcing amongst physicians. Bump Club and Beyond is not a medical group at all. It's a group that was formed to provide information to pregnant and new mothers. That's been around for a long time, but by partnering with them, we were able to get our messaging into those communities, so non-medical communities of mothers. So really strategic partnerships were key to our success. So in order to create the group, we started off by determining what our vision was, which I think is important when you're creating any sort of group or initiative or advocacy project. The next thing that was really key was organizing a team. You have to choose an issue. So it might be, if you're forming a group, it could be a general idea of what your issues are going to be. If it's one issue, you need to figure out what that issue is that you're going to focus on. You need to figure out what tools you're going to use to move your advocacy mission forward. And then finally, you need to actively promote your messaging on social media and engage all of your communities. So for impact, the way we determined our vision, back in March of 2020, when the pandemic had just started, myself and a group of physicians in Illinois were panicking, to be perfectly honest, because we saw all of these tweets going out on social media. We saw in our city people were out partying, and it didn't seem that anyone understood how dire this situation was or how urgent it was. So you can see here a picture of a tweet that I put out, just starting that public messaging, trying to tell people that they needed to stay home, we weren't talking about social distancing in the media as much at that point, but it was something that we were trying really hard to get that messaging out there and get people to understand that they needed to stay home, because we were going to be in some deep trouble if we didn't start flattening the curve right away. So that's how we determined our vision as a group. The next thing we did was we organized a team. So we had 7 founders, all physicians and all parents of young children. And then the biggest thing that we did that I think was really key to any successful team, whether it's advocacy or not, is we recruited other individuals who had expertise that we did not have. So we recruited pharmacists, public health messaging experts, PhDs, MBAs. We have social workers, we have nurses, we have nurse practitioners. So it was really important for us to have a team that was made up of people who had various different levels of expertise and life experiences as well. The next thing we talk about is picking an issue. So throughout this pandemic, there have been a slew of different issues that we've had to focus on. We started off by focusing on social distancing and masking, and then we transitioned when vaccines came out to talking more about vaccines. So whatever the issue was, that's where we focused most of our efforts to make the maximal impact at that time. The next thing is selecting an advocacy tool. So this is really key. There's a lot of different advocacy tools that are out there. And depending on what you're trying to accomplish and what audience you're trying to reach, you need to figure out which advocacy tool is going to be the most effective. So one example of an advocacy tool would be a petition. So we actually started a change.org petition to move towards a federal mask mandate early on in the pandemic. And when we did this, we partnered with several of our other collaborators in the hope of amplifying our message and getting more signatures. And we reached over 100,000 signatures pretty quickly. The other types of petitions you can also have are petitions locally, where you have a letter or you have a petition that you create that you send to your local local government officials. But this type of petition on change.org is fairly easy to make. And if you want to close the petition and send it as a message to whoever the petition is targeted at, this is a great way to show public opinion and to show how many people support whatever it is you're trying to advocate for. Another really great advocacy tool is writing. So we wrote quite a few op-eds over this last year, and we targeted our op-eds depending on who our audience was. So there were some times where we were really focusing on trying to get our messaging to those in healthcare. So in those cases, we'd usually target Kevin MD. There were other times we were trying to target the general public. So we wrote something in USA Today. We've written in Medium. So there's a lot of different ways that you can use op-eds to advocate for whatever your efforts are. The important thing when you're choosing to write something is to figure out who your audience is, who do you want to reach, and where do you want to get this op-ed published. Next thing is letters. So we wrote a lot of letters, and there's different varieties of letters. So there's letters to the editor that you can get published in a newspaper. There's letters that we sent to our local government officials, so our governor and our mayor. And sometimes with those letters, what we would do is we would get signatures from social media, where we would post in the Physician Mommy Chicago group, which is run by one of our co-founders, and ask physician moms in Chicago to sign on to whatever it is that we felt was important at that moment. So we've written letters initially about the shelter in place, about masking. We've written a variety of different letters. And we've also put out statements that have actually been picked up by both local and national news organizations when we think there's something dire happening that we need to put a statement out about. The next thing that we did that was really effective in amplifying our messaging is we utilize social media and we engage the community. So we created social media platforms for impact on Twitter, Facebook, and Instagram. And we also created a LinkedIn profile for impact. We partnered and posted in a lot of Facebook groups. So I already mentioned Physician Mommy Chicago. Over the pandemic, so many other groups formed. So there was the Illinois COVID Collective. There was a vaccine group that opened up recently that had non-physicians in it. We posted in groups that were other physician mom specific Facebook groups. So Facebook was a really great way to not only get our messaging out there, but also to crowdsource where the needs were, and also to get signatures when there were letters or statements that we wanted to put out that we thought needed more voices behind it. We also created Twitter amplification groups. So what that basically entails is having a direct messaging with a group of people. And we utilize that whenever there was something we wanted to amplify, you could post it there and then everybody in the group would retweet it or message it or comment on it. So it was a really great way to get our papers, our pieces out there and amplified. And then we also utilized our partners network. So for example, the Illinois State Medical Society will often put out the statements that we have jointly made. Bump Club, we do Facebook Lives with them. So we utilize their networks, and in that way we've been able to reach millions of people as opposed to the thousands we would have been able to reach with just our own networks. So the recipe, this is how we work. We repurpose content. This I think is really important. So for example, if we were to create an infographic on a specific topic, say the importance of masks in schools, the next thing we would do is we would also have a blog post that would go along with it. We would also plan to have one of our YouTube videos, the impactful chats that we do, an interview, where we would try to keep it on the same message. We would try to also have the same messaging in the Bump Club live chat that we do every 2 weeks with the Bump Club group. And then we would try to leverage all of our outreach with the local and national media and let them know this is an infographic we put out, this is other content coming around the same messaging. And then we would disseminate and amplify it really across the board with all of our partners. I think it's really important to note that when we did this, it's much easier to repurpose content because you already have all of the information there. You just need to find different ways to present it so you can reach different audiences. Some people get their information from infographics, some get it from podcasts, some get it from YouTube, some get it from Facebook, some get it from their local newspaper or TV station. So taking the messaging that we thought was important and repurposing it to multiple different avenues increased our reach as well. You can see a graphic on the lower left-hand side here looking at our data updates. We have a data analyst who basically throughout the entire pandemic would put out daily updates of the numbers, where cases were, where ICU bed hospital utilization was. So especially before this type of information was being transparently released on a local and national level, our group was putting it out there pretty regularly in easy to digest and easy to understand ways so people not in healthcare could understand what was happening with the pandemic. And as you can see here, our work has actually led to me having a recurring segment on a local news station, and we've leveraged our reach to multiple other news outlets, which I'll be sharing with you. So here's what we've accomplished in a year, and this slide doesn't even begin to cover all of the things that we've accomplished. So on social media, our collective social media platforms have over 3,000 followers. We've had 2 petitions put out there. That one, like I said, was over 100,000 tweets or signatures last time we checked. The other one was about over 4,300 signatures last we checked. We had a virtual White Coats for Black Lives March that was actually Zoom bombed. We ended up re-recording the entire session, and it ended up reaching over 1 million views in just 24 to 48 hours. Our infographics that we put out in multiple languages have had 1,000 to over 15,000 views on Facebook alone. So that's not counting other platforms. Our Facebook Lives with Bump Club have over 1,000 views. Same thing with our impactful chats. And then we published quite a bit. So in the traditional media platform, we published over 40 op-eds and letters to the editor in news outlets from Chicago Tribune to the Huffington Post to USA Today. We've been interviewed and featured on Good Morning America, the New York Times, Time Magazine. We've written over 12 advocacy statements and letters to policymakers, and we put out 6 public statements from our group itself. We've also created this this kind of trusted messenger, trusted messaging campaign, I guess you could say, within our organization. We utilize our own personal experiences as mothers as well and fathers to give personal anecdotes and explain why this is so important to us. And because of that, we've been able to leverage our roles as family members, whether it be wives or sisters or daughters, to really get our messaging out there and reach people who often think of doctors as not people who they can connect with or relate with. And that's been really powerful messaging. We actually, as I mentioned, were interviewed in Time Magazine specifically because of this, because our work and our work educating on this infodemic and fighting misinformation was something that they found to be very interesting, especially the fact that the entire group is made up of volunteers who do this in their free time in the midst of a pandemic. Of course, we can't ever talk about engaging on social media without talking about some of the risks. So as we published in a paper earlier this year, prior to the pandemic, we did a survey looking at physicians engaging on social media, and we found that 1 in 4 had been attacked and 1 in 6 female physicians had been sexually harassed. So it does not come without its risks, but that being said, I still very much encourage people to engage on social media. And if something like that were to happen to you, we've created an entire toolkit on our website. And there are also groups such as Shots Heard Around the World and PEN America who really work towards protecting healthcare workers and physicians who are putting their voices out there and advocating for science-based, evidence-based messaging and education. I want to talk very briefly about a case study and how we used all of our platforms for vaccine access over the last 6 months, especially basically since December when the vaccine started to roll out. We knew that the messaging and the approach here was going to be different from our advocacy work when it came to masks, because we needed to not only provide education about vaccines, but we also needed to address vaccine hesitancy and also advocate for more equitable access, because we knew with vaccine hesitancy plus limited access, that was going to lead to a huge issue of vaccine inequities, which we have seen as the vaccine rollout has happened. So what we did to start was we started to engage with our communities within the healthcare field to identify what the needs were. And what we found at the beginning of vaccine rollout was physicians and healthcare workers who weren't affiliated with a large institution weren't able to access or get their shots. They couldn't get vaccinated. So we began advocating for that, because that was something that I think a lot of people hadn't realized when the vaccine rollout started, was getting these unaffiliated healthcare workers vaccinated. We talked to Oak Street Health, where our chief policy officer has a leadership position. And so we actually amplified the process for many other healthcare workers to realize that they could come to this Oak Street Health clinic to get vaccinated. And we found that 50% of the thousands of healthcare workers who were vaccinated at Oak Street Health in the first couple of months were actually referred by social media. And so that was a direct result of our campaigns to make sure that the unaffiliated healthcare workers knew where to go to get their vaccines. And then our chief policy officer, Dr. Ali Khan, was actually invited to speak at the Chicago Mayor's press conference about vaccine equity because of all of the advocacy work that we were doing to get people vaccinated. We then, when the healthcare worker challenge was overcome, the next issue was when it became available to the general public. So the first thing we realized was there were large tech inequities. And so we advocated very aggressively for more equitable ways for people to access their vaccines. So after those initiatives started to be amplified, the state actually incorporated in telephone lines where people could call as opposed to just the online sign up. And Chicago also unveiled the ZocDoc platform. We were very concerned about the first come, first serve websites that were there. And so some members of our team penned an op-ed, and we joined the Chicago Vaccine Hunters, a Facebook group. And we were able to get a lot more people vaccinated by just partnering them with others who were able to help them get appointments. You can see here a couple of the things that we published and that we were interviewed in. I spoke with MIT Tech Review about how different platforms were making a more equitable access to vaccines to our communities. Then we talked about the biggest one of the bigger challenges was education and vaccine hesitancy, because there was a lot of concern that the vaccines were rolled out too quickly, that there was a newer type of technology. And so we started creating infographics. Initially there were 5, I believe we have more now, and they were all also translated into Spanish. And we wrote 5 advocacy letters. We created frequently asked question blog posts. We also, in our infographic series, created an entire fact versus myth infographic series, which you can see on the right-hand side there. We crowdsourced healthcare workers and non-healthcare workers, asking people who weren't interested in getting the vaccine why. And so we learned a lot of misinformation that was out there, and we crafted targeted campaigns to better address the misinformation. The biggest thing that we did, and that's still ongoing, is we created a vaccine clearinghouse, which has, when this presentation was put together, it resulted in over 13,000 hits, but I bet we're probably at closer to 20,000 now. We've recruited and organized over 1,000 volunteers now, and we partnered with the Chicago Medical Society and other organizations. We've also created an Impact Speakers Bureau to provide speakers to community events, and we partnered with the Chicago Public Library. We've also done a lot of outreach events in the community, not only educating and giving talks to schools and churches, but also our Chief Development Officer, Dr. Halak Barnia, has been able to basically provide volunteer vaccinators across the state in locations where people are most hard hit and are having the hardest time getting vaccines. So we've been able to address the education aspect by partnering with community organizations and speaking, and we've been able to target the equity issue by providing not only volunteers, but also really getting the messaging out there when these programs and these events are happening. This vaccine clearinghouse that we created, as I said, it's resulted now in over 20,000 website hits. You can see on the left-hand side, it's basically a real-time update of where people can get vaccinated. At the beginning of the pandemic, it was a real struggle for people to find appointments and figure out where appointments were available because the supply was not meeting the demand. So our team was basically able to create this clearinghouse where people could go at any time of day and figure out where they could sign up for a vaccine appointment or get put on a waiting list. Or this, I think, was probably the coolest thing. It would be a note where it would say, this location is opening up vaccine appointments at this time. Make sure you log on at this time. And we had tips and tricks for how to get vaccine appointments. We also created this infographic that we made into a poster that a lot of physicians' offices have actually printed out with a QR code where patients could basically use their smartphones to access the information on their phone. And so we partnered with a lot of organizations to really get the messaging out there, especially to those people who did not have internet in their homes or did not have access to the information that many other people were finding difficult to access. And the final thing that I think is really important when it comes to what we've done over the last year, the case study that I just described with the vaccines is just one example of the work we've been able to do. I think one of the reasons that we've been so successful, not only because we've created this recipe and created this cascade effect of all of our messaging, but we've also made a really strategic and intentional decision to lift up future leaders. So we have these phenomenal interns who are medical students, and we have several pre-medical students who are also interns who have worked with us throughout this year. They've created infographics. They've actually had 5 or 6, I believe now, oral and poster abstracts presented based on our data and based on our research from the last year and based really on just what we've been doing. They've been able to speak at national conferences. They've been able to understand a little bit better the power of your voice, even at any level in your career, from the pre-medical time all the way to when you're retired, because we do have some retirees in our group as well. We partnered with the Urban Med program at the University of Illinois, and that's where we get our interns from. And we've been very fortunate to have phenomenal interns who've been able to not only help us, but hopefully help them in their careers as they learn how to navigate these waters, but also have some pretty cool things to put on their CVs and their ARIS applications moving forward. So we've been very lucky so far this last year. Some of the lessons we've learned: we know that healthcare worker voices are needed more than ever. We know that we're stronger together, and it's really important to find a community of people who can support you and amplify you and your voice. And so we try to be that for the healthcare workers in Illinois. When we talk about take the baton, pass the baton, and lift as you rise, so important to make sure that everyone is being amplified and is being equitably, intentionally, and strategically given opportunities, and supporting each other is a key to what we do. We talk about leading from where you stand. So many of our medical students have actually published in the national press because they've been able to write in ways where they talk about their own experiences as medical students. And with mentorship from our group, they've been able to publish everywhere from the New York Times to US News and World Report. When you do advocacy work, it's really important to think about skating to where the puck is. So the really important thing to remember is these types of issues are going to keep coming up. You need to think about 5 months down the road, or 5 weeks down the road, or 5 days down the road. What is the messaging and what is the important advocacy that you need to be doing that's coming up? not just what's happening in real time, but what's going to be the next challenge and how can you plan to create a strategic plan for addressing that. And then thinking outside the box regarding partnerships. Our best and most robust partnerships have been with people both within and outside of healthcare. And that's really how we've been able to amplify our messaging to places that we likely wouldn't have been able to if we just stayed within the healthcare space. I want to acknowledge our team because we have a phenomenal team of physicians, nurses, social workers, pharmacists, health policy individuals, data analysts. We really have an amazing team, and this is only a small segment of them. So I just want to put a huge shout out to the Impact team for all of the work that they've done in this last year. And I want to encourage all of you to try to utilize this recipe if you need one to create your own advocacy messaging, whether it's for one issue or one initiative or for a larger set of initiatives. We found the strategy to be incredibly effective, and it can definitely be effective for you as well. Thank you so much.